Good evening, doctors. Good evening, doctors. And our today's topic is hypothyroidism. So, I'm going to explain you about hypothyroidism. What does it mean, hypothyroid? Hypothyroid means, my dear friends, there is reduction of thyroid hormone. Reduction in thyroid hormone. This is known as hypothyroidism. So, my dear friends, in hypothyroidism, firstly I am going to explain you a little bit, and then we are going to do the classification, treatment, investigation, everything. There is a reduction in thyroid hormone. So, firstly, if you haven't watched my endocrine physiology lecture, so please watch that lecture, endocrine physiology. I'm going to explain the thyroid axis and what happens with later the thyroid hormone reduction. What else happens here? The TSH level role. What happens with TSH? TSH increases here in hypothyroidism. T3 and T4 decreases, my dear friends. Decrease sign. And what else happen here? You know what? T3 and T4 bind I'm writing by this way. T3 and T4 bind with thyroid globulin, thyroid TBG, thyroid binding globulin. That's why if we wanna investigate the hypothyroidism, we need to take a free T3 and free T4. Why? Because they are not bind with anything. So TSH and free T3, T4 level we are going to measure in it. And what else I wanna explain you about kind of symptoms in hypothyroidism. You know what? A basal metabolic rate, BMR. Basal metabolic rate decreases. So I'm going to start from here till the bottom in both male and female. What kind of symptoms? Hypo means, you know what? Hypo means low, everything low. If we thought about CNS, depression, decreased depression on CNS, from top to bottom we are going to come. Depression, and what it control our brain? Reflexes. So decrease reflexes, my dear friend, decreases here. All the reflexes of body decreases. Cold intolerance, okay, in CNS. Okay, I'm going to write in this way. Depression, decrease reflexes, cold intolerance, fatigue. These all are related with CNS or central nervous system. And then come down here on neck. What we see, like neck, goiter, Allah's thyroid gland is known as goiter, my dear friends. And what else happen here? There is on heart. If we think heart, we take heart on CVS system on heart. It includes bradycardia, low heart rate, and hypotension, low. I already told everything goes down in hypothyroidism. If we think about now GI tract, GIT, there is constipation. Why constipation? Because low metabolism, gut motility decreases. That's why here constipation occurs. Patient is very lazy. If we think about like here alopecia, low hair growth or absence of hair alopecia, my dear friends. These are the symptoms. And if we think about some more other systems like kidney, there is also some effect. Edema occurs in hypothyroidism, my dear friends. Slow tendon reflex. If we think about female, in female it causes what? In female it causes menorrhagia. What is menorrhagia? I'm going to explain in outstanding videos. So menorrhagia is more than 80 ml blood loss per day in normal periods. Okay, it's known as menorrhagia. Galacturia. These are the symptoms, my dear friends. It's very necessary to understand. And tongue enlarged in hypothyroidism. You have to remember, if you see such kind of patient, such reflexes, slow reflexes, holds dry skin. If we see dry skin, cold intolerance, everything, carpal tunnel syndrome. If metabolism is slow, so everything digests slowly, what going to happen? Weight gain, excess weight gain here, lot of weight gain, my dear friends, in this. And I am going to I hope till here, for every hypothyroidism symptoms are nearly same, and we are going to identify. And now I am going to rub this one. Okay, my dear friends, and then we are going to continue another now classification and how to identify and how to diagnose hypothyroidism. These are the symptoms. So on clinical basis, patients going to explain you, and this topic is my very well. So now I'm going to explain you what kind of hypothyroidism. Firstly, primary hypo. I'm going to write in this way: hypothyroidism primary. And what kind of hypothyroidism? Firstly, we have to know in there what was the problem. Here, the thyroid gland reduction, thyroid gland problem in primary, thyroid gland problem in thyroid gland problem. So hypothalamus, HYPO, I'm going to write in this way. It is hypothalamus, then thyroid releasing hormone, then anterior pituitary goes in, and then anterior pituitary releases here TSS, thyroid stimulating hormone. Then here it goes to thyroid gland. So our problem in primary is thyroid gland. It releases T3 and T4. So my dear friends, in case of primary hypothyroidism, there is a problem in thyroid gland. Okay, what was going to be happen if thyroid gland is not working properly? That means the level of T3 and T4, what was going with them? They are going down, releasing less T3 and T4. So what happened in primary? T3 goes down, T4 goes down. But what happened with TSH? If it gives a signal to hypothalamus that in our body T3 and T4 is low, so what happens? TRH increases. Why TRH increases? Because they misinterpreted body level hormone decreases. So anterior pituitary also release TSH more, but T3 and T4 is low in case of primary. That's why the problem in. So what happens? TSH here increases. You know, my dear friends, what was the normal value of TSH? It is 0.5 till 4.5. Okay, so I hope till here it's understandable for you. So now we are going to discuss what kind of primary hypothyroidism. There is a most common worldwide is iodine deficiency. Hypothyroidism is the most common worldwide. Second one is Hashimoto's thyroiditis. In my lecture thyroiditis, I already explained about the Hashimoto thyroiditis. Here also we are going to discuss. I am going to explain again. So my dear friends, don't worry. And another one is like by radiation. Sometimes radiation induced hypothyroidism. Sometimes radioactive iodine uptake hypothyroidism. Sometimes drug induced. Drug includes which drugs? Amiodarone, lithium, sulfur drugs. These are the drugs which causes the hypothyroidism, my dear friends. Acetyl salicylate also. So what was the treatment in such cases? You have to take the history of patient which drug he is taking and then stop these drugs. Okay, so it was a treatment in such cases. So my dear friends, or any thyroiditis. Fifth one is any thyroiditis. It causes hypothyroidism. So I hope till here it's clear. Thyroiditis I already represent individual lecture. So now I am going to explain you what is Hashimoto thyroiditis. HT I am going to write. This is already explained in thyroiditis lecture, but here I am going to explain again. It is chronic autoimmune destruction of thyroid gland. Thyroid gland. Autoimmune destruction of thyroid gland, and which causes the T3 and T4 level down and TSH increases. Why this happen? Due to TPO antibodies, thyroid peroxidase antibodies, or due to the TG, thyroid globulin antibodies. It destroys the thyroid gland in such a way. So what else here happen? It is associated with some disease like autoimmune SLE, rheumatoid arthritis, like psoriasis, HLA-B27 associated, and PBC. It is primary biliary cirrhosis. These are always associated, sometimes associated with autoimmune diseases, my dear friends. And what are the complications? Hypercholesterolemia. You know what? The hypercholesterol level increases, lipid profile increases, bad lipids increases, and there is anemia of chronic disease, ACD I am going to write here. And what else? Hyponatremia, electrolyte disbalance, hyponatremia. And what was the most accurate test is biopsy. Surgical biopsy is the most accurate, but we are not going to take in all the cases. And treatment by levothyroxine. I think you do not need these doses, but I am going to tell you 1.6 microgram into kilogram body weight. So see, if patient weight is, I think it's nearly 50 kg, so 1.6 into 50, and that was the microgram doses we need to give. If patient is, this is the primary hypothyroidism. If patient is pregnant, if she is pregnant, then what we need to do? In case of pregnancy, hypothyroidism can damage fetus, and it causes cretinism, mental growth development. So it's very much necessary to recheck thyroid TSH levels in pregnancy. If it is between 5 till 9, we need to check TPO antibodies also, but in pregnancy we have to be very sure. Okay, my dear friends, and because there is a fetal can be developmentally disturbed cretinism in case of hypothyroidism. If we are not going to rule out in first trimester, we need to check the TSH level, and if TPO antibodies is positive, then we need to treat that one. If it is between 5 and 7, sometimes it's physiologically also increases, so consult with doctor. Okay, you can ask me also about this question. I can explain you because I already have experience in such cases. So my dear friends, it is very important. I hope primary hypothyroidism is clear for you. Now we are going to, and doses are not very important for you, because doses we need to titrate and we need to recheck by our own practice. So this is for a theory course. I hope this will help you enough information. Now we are going to discuss about secondary and tertiary hypothyroidism. What is secondary and what is tertiary hypothyroidism, my dear friends? This is the, I already told. Okay, here I am going to draw again. TSS, thyroid gland, and then it releases T3 and it releases T4. Okay, so in secondary, what is going to be happen? Secondary hypothyroidism. In secondary hypo, there is a problem in secondary hypothyroidism. There is a problem in where do you think? There is the problem in anterior pituitary. in secondary. So if anterior pituitary is not working properly, that's why here the TSH level goes down. And if TSH less secreted, so thyroid hormone secreted less T3 and T4. So what was happened? Why secondary? Due to tumor of pituitary tumor or any mass. It causes TSH decreases, T3 decreases, T4 decreases. Panhypopituitarism, not pan, but here it is TSH, T3, T4 decreases. But in case of tertiary hypothyroidism, what was happen? There is decreasing. There is a problem in hypothalamus. So hypothalamus problem, it releases less TRH, less TSH, less T3, less T4. Everything goes down in tertiary, my dear friends. I hope till here it's clear for you. And I already told the complication of hypothyroidism. The complication of the hypothyroidism, I explained that one is hypercholesterolemia, anemia of chronic disease, and there is a complication is mixed edema, coma. Okay, so now we are going to discuss about the mixed edema, coma. What is it? Now I am going to write mixed edema, coma. Edema, coma. It is a life-threatening condition. Life-threatening condition in which, due to untreated hypothyroidism, it's a very severe thyroidism condition, my dear friends. Why this is happen? This is happen with insult, infection, causes, medication. Some I already explained which one. Prolonged exposure to cold, exposure to cold. Okay, my dear friends. And what else? Symptoms ALOC S6 I'm going to write. Acute loss of consciousness. Patient loses consciousness in mixed edema, coma. And what else? Coma, delirium. Such situations occur. Stupor. It's a very severe condition. Lethargy. Patient is lethargic. Bradycardia, like hypothyroidism symptom. Hypo is hypotension here. Decrease RR, respiratory rate slows down. Sign of pleural effusion here, pleural and pericardial effusion, my dear friends here. And so try to understand. In such situation we need to ask CBC there, WBC, left shift, because WBC counts increases, neutrophil increases. We are going to electrolytes laboratory, see sodium level, hyponatremia, severely hyponatremia. So what we are going to treat with IV levothyroxine. I am going to tell you, my dear friends, in India I haven't seen levothyroxine IV, not available. Okay, but we can give high doses of thyroxine. It's very severe, very severe condition, mixed edema, coma. So we can see firstly ABC also, airway, breathing and circulatory system. So we can, if there is oxygen deficiency, yes, oxygen deficiency, we need to give 100% oxygen, because there is hypoxia, stupor, oxygen. And if patient is hyponatremic severely, we can give 3% NaCl, sodium chloride. My dear friends, I hope it's clear for you. If you watch my more videos like endocrine physiology and everything, and some videos on hypothyroid, hyperthyroid, thyroiditis, thyroid cancer and thyrotoxicosis, if you are going to watch all these videos, your concept going to be very clear. And you need to read books also sometime for more information. I hope if you watch my videos, you are getting enough information You can answer any question easily, you can crack any examination because they are asking only basics. Thank you for watching my channel and watching my videos. If you haven't subscribed my channel still now, so please don't forget to subscribe it. Please subscribe my channel, and if you like my video, please put like on it. And if you want to study any topic individually, you can ask me. I'm going to put video on that. And if you want any kind of improvement on my videos, please write me a message or comment. I'm going to improve my videos more. So my dear friends, thank you, have a good night, good day, welcome.